So this is the triage, or how to manage the disaster. When we need the casualty management, we have to categorize the patient. Which patient you has to go first to check, right? What patient you little bit take time and they will not die. So triage or casualty management would categorize the patient in 4 groups. The class 1 or most priority is called priority 1. It is class 1 or red tag, right? Red tag means immediate care. The patient need immediate care. So immediate threat of life, if you do not give them immediate concentration, they can die. The red tag patient example like breathing issues, stoppage of respiration, something inside their respiratory system, asphyxia, pulse oximetry going down, hemorrhage, wound, or major burn. They need immediate care. A patient is a major burn, you give them IV saline, you can save the life. A patient is a hemorrhagic shock, bleeding is occur, you stop the bleeding, give saline, and patient you can save life. Something enter inside the baby's respiratory tract, you remove it, and babies or infant or any patient can continue the respiration, you save life. So red tag, I'm saying they need immediate care. The class 2 is yellow color. This is called the prioritization patient category 2. They are emergency as well, but they are not emergency as the red tag. They does not need immediate. They are important, but after the red tag. So class 2 yellow tag here, the major injuries that require the prompt the treatment, but not like the red tag. Most common example of yellow tag or yellow delay service we need, like bone fracture. So bone fracture patient feel pain, but they does not die within short time. They do not die within short. So you can take little bit time. So here the said may require the immediate attention, but can sometimes wait for hours. So who are the patient for yellow tag or class 2? Like abdominal wound or soft tissue injuries, gastrointestinal injury, eye injury, or central nervous system or CNS injuries. They are yellow tag. The immediate red tag example, chest wound, airway obstruction, shock, pneumothorax, means air inside the lungs, or second or third degree burn or major burn. They are immediate care. They need immediate care, right? And the keyword about the class 1 or red tag, patients are so anxiety work, apprehension, restless, they are confused, also change the level of consciousness. What are the first sign of level of consciousness? Increase the intracranial pressure. So increased intracranial pressure is the first sign of change the level of consciousness. What are the signs of increased intracranial pressure? Increase the blood pressure, increase the temperature, decrease the heart rate, decrease the pulse rate, the sign of increased intracranial pressure. Now go the category type 3 is called class 3 or green tag. Class 3 or green tag is called minimal green. So class 3 or green tag, this is a minor injury. Minor injury does not require immediate treatment like red tag or yellow tag. Example of green tag like abrasion or cut or broken little bit, not too much, pain. So treatment is needed in hour to delay or day. So if patient wait for a long time, they will not die. So client may be moved away from the triage area, right? So what the example of class 3 or green tag is upper extremity fracture, means your two hand breakdown, upper extremities. Minor burn, minor, not major, means percentage of the burn is less, or small laceration, or some psychological disturbance. This is the green or class 3. And last one is the class 4. Class 4 is the black tag. Black tag, right? The class 4 is the black tag, means expectant black. Means patient, whatever you do, they will die. Patient condition is really bad. Expectant, die. So class 4 or black tag, expectant and allowing to die. Example of black tag patient are penetrated head wound or chest crush injuries, very bad chest crushing injuries. So from your experience, when you see the patient, you can understand, okay, maybe patient, whatever you do, patient will die. It's called the black or expectant category or class 4, expected and allowed to die. So some information about class 4. Injuries are intensive and chance of survive are very unlikely. Give them comfort, separate from others, but do not abandon. And here's some example of class 4 black tag patient. One is penetrating head injuries or burn in excess of 60% body. So if the percentage of burn more than 60%, the patient is very hard to survive, or seizure or vomiting within 24 hours exposed to radiation, or profound shock with a multiple injuries, absence pulses, absence blood pressure, fixed and dilated pupil. So absent pulses or absence blood pressure, or means vital sign not measurable, absence blood pressure, no pulse, dilated or fixed pupil indicate patient is close to die. Time is here to say goodbye. But always in this stage, we have to try to give them comfortness, painless death, right? So this is the category or prioritization on base of triage. Sometimes NCLEX board asks the question from here.